Look, this is the injection point here. Look, so now I must go through the proper square, yeah? But I'll try and go medial to the artery that I can palpate. So there we go. And on the bone. Always do a two-hand aspiration, so you do a big suck like this. Now I'll hold for more than 3 seconds to make sure that I don't have any problems. And then we can go like this. Now, if you watch now as I'm injecting this 0.5 cc, you will see that there's a visible projection here, but also you'll see that the brow is going to start to lift. Also that the lateral canthus should also start to become more positive. And we can also assess whether or not she has any dynamic endpoints here, like, you know, crow's feet reduction, etc., that might also improve. Now, nice and gentle. See how slow I'm going? Because I want it to hydrodissect underneath the fascia here. So I come out nice and slow. Now watch this. When I come out slow, like this, like that, I don't have blood. Because what happens there is that I have a tamponade effect. This is 7 layers here, right? So all those layers, they're all sealed behind me. So it's like a fire in a building. All the doors will close and stop the fire from spreading. So even if she has a bruise in level 7 or 6 or 5, we won't see it in the top. Right, here we go. So let's take a look now. Look at the amazing brow lift that she has. It's just immediate. You see? Let's have a look at everybody. Yeah. Also, she gets a kick point on the brow, which is at the right position. You see how this is a lot more lateralized. This is too acute, yeah? Let's have a look here. Yeah, it's amazing. Also, see the negative tilt on the eye is starting to open out. So the eye starts to look more happy and less tired. Okay. Now we're going to do the cheekbone. So we do the notch on the cheek. You must feel, those of you that are less experienced, you have to get this right. When you touch the notch here, this suture point, if you inject lateral to the ligament, you may actually just give widening but without lifting. So you wasted an opportunity. So feel for the notch. There it is. Right here. I'm going to mark that with the product. And no, I don't do that to anesthetize the skin before I inject, which a lot of people ask. They say, oh, he's so nice because he numbs the skin before he goes. Yeah? No, it's a sterile marker for me. Okay, so turn this way. So what I do is now, open the door, yeah? So I pull the ligament backwards, and then I retain the zygomatic arch between the index finger and the thumb, and then I'm injecting from above onto the zygomatic arch, touch the bone, okay? And then we inject here between 0.1 and 0.2 cc, right? You probably thought then, he didn't aspirate. There's nothing there. There's nothing there, right? This, as I said to you, Nicola, it's the safest injection point on the entire face. You should really aspirate, but I'm 100% confident there's nothing there, right? Okay, so what I do is now, then I pinch the voluma into the ligament like that and squeeze it, hold it in position. But I can also mold it into the margins of the zygoma. If you want to be really cool, you can put your finger on the inferior border of the zygoma and mold it into your finger like this, because then it creates a very high definition cheek, and you'll see, for those of you that are down there, it's amazing, huh? So it immediately gives the impression of beautification, feminization, and also, you know, this kind of facial slimming effect that she wants to have. Now, I can't see from here, but is this better? Not. Right, excellent. The reason for this, look, SMAS lifting. So I took the SMAS and I lifted it up like this. So if you get this right, you have effects all the way through here, and also you have this beautification endpoints there. Let's go back. Next point now is to identify, and keep ups, is to identify the zygomatic retaining ligament, yeah? So, you can't see it now, can you? No. Then you must move her. Come forward. Down, down, down. Now can you see it? Yes, there you go. More down. There you go. So zygomatic retaining ligament is here. Right. So this is the malar mound. She has edema. That's no go. Yeah? So back. So this ligament is falling down. So what we're going to do is we're going to pull it up, then inject medial to the ligament. Now, we said, you know, between 0.2, 0.1, 0.2. And again, look at what I'm going to do with this. This is a ball of, like the kind of honey, like treacle, yeah? Treacle. Do you understand what that means? Like a kind of honey that you put the spoon into. Yeah, it's thicker. So I'm stick it into the ligament like that to push everything backwards. But also I start to take this ball of pastry and roll it like this. So I'm going to roll it now upwards towards the tear trough so that we start to push the ligament upwards and make the lid sheet junction shorter, right? So forwards. Is the tear trough on this side starting to get better? Yeah, okay. Also, what you should also see, there should be more sagging of this compartment than this side. Means it should look slimmer. Is that right? Yeah, good. Has the nasolabial fold improved?
It is.
Right. So you see, yes. So we're achieving a lot of indirect improvements by injecting indirectly and, if you like, distally, but also incredibly safely. Look, guys, this is the safest injection point in the whole face. This is the most dangerous. We made this better by injecting this safe area. So if you guys who want to just have, you know, safety and reproducible results, stay in the cheek for the time being. All right, now we stay with the voluma. We're going to build her an angle of her mandible. Okay. We make the L-shaped angle of the jaw. You can see between my index finger and the thumb, this is the angle that the bone is currently sitting at, which actually is too square. So we do one injection here, actually on the angle. Now then, look at this. Look how far I had to reach to get to the bone. Means that she has a retrusive angle. Aspiration, and then inject, okay?
It's on or beside?
It's on the bone. You have to be on the bone, darling, because if you miss the bone, you're in deep trouble here. So this is the perpendicular angle, like so. And now, see, I've done this submandibular hollowing and sulcus. Now I'm going to inject, look onto the back end of the angle. Now, if I inject here and I miss below, I've got the external carotid right underneath me. If I miss it above and I'm not on the bone, then I'm in the body of the masseter muscle and there's arteries there. So you've got to be on the bone here. So I identify, see, I'm going just above my finger and then just, hold on, see, I didn't get to it there. No, not quite again. And now on. Aspiration and inject 0.1. And what that does is now it gives me a posterior border. Can you see that?
Yeah.
Right, so if we have a look at the lift effect now for this, can you see, everybody? This angle now has become, instead of it being square, it's become more obtuse. You see this? This is the female angle, right? Come forward and then turn this way. You see on this side, she's too square and ill-defined. The other thing is the jowl on this side improving? Right, okay, take a look here. The jowl effect, yeah? So it should be getting better here. If we really want to examine what kind of indirect effect we have on the SMAS, let's look at the neck, right? Can you see, everybody? She has more fullness here than here. Just turn gently this way, show everybody.
Oh, yeah.
Can you see?
Yeah.
So she's sucked in. Yeah. Right, it's the platysmal tightening because of SMAS, sub-SMAS injection. So this I would describe as sub-SMAS lifting. That's why the plastics, they hate me. And they'll hate all of you as well because, you know, this is a surgical type of effect, isn't it? Okay, now let's go back. Now we're going to fix the jawline. And we're going to identify where is the prejowl sulcus. So the prejowl sulcus is the the sulcus between the mandibular retaining ligament and the lateral border of the mentalis muscle. She has a wide prejudicial sulcus, which means that
Sorry.
it's all right. Which has a wide prejudicial sulcus, which means that it's more than 1 point. All right, so we're going to divide it into 3. So I put my finger on the inferior border of the mandible, like so, and I go 1, tiny ball, and 2, and 3. Now, just what I'm doing is I'm joining the the jaw to the chin in one linear relationship. So what I do now is with these 3 balls, we're going to fuse them together like an Audi badge, yeah, all linked. So relax, that's it. So what I do is, look, I put my finger on the inferior border as a sort of mold, and then, look, I'm going to fuse them together like that, okay? And as I do that, I can feel them all soften and connect with one another now. And that means that underneath the DAO, they're forming like a lozenge, like a cylinder, yeah, like a sausage basically. And then they're together, and now what we should have is continuous transition from the jaw with no jowl effect, yeah? And that's like a high definition jawline with high definition cheeks. And that's really what the young patients want these days. She has a hole here and it's fixed on this side. Thank you. So now we're going to treat the labiomental crease. Don't forget, the labiomental crease extends from the midline all the way to, look, to here. Goes all the way across. So from here to there, center. So we begin here, and this one is on the bone. So now what I'm doing is, I'm going to inject her on the bone underneath the DAO muscle. And what you'll see is something magical. Because when I project the DAO now, and I stretch the muscle out like this, the muscle can't contract so much. If the DAO starts to weaken, which muscles will become stronger? These ones. Right. So let me just we'll do 2 more just to go across here. So now I'm going to be sub-Q, voluma.
And you go oblique.
I follow the crease, look, all the way to the center like this. Here we go.
I know these ones hurt though.
Now then, yeah, but with cannula it hurts a lot more, I think. Right, now, tell me everybody, what has happened to the corner of the mouth? Yeah, but we didn't touch it yet, yeah? Yeah, amazing, no? So she's probably sad here and happy here. Now, this is the issue. So if you go, like, our human brain is conditioned to seeing problem and go straight for here, yeah? If you did this straight away, you would never get this result because you're not dealing with the cause, which is the DAO hypertonicity. So let's take a look. That's just amazing. Also, I made her mouth wider here by doing that because I'm allowing, what's also happening? Risorius and zygomaticus major both now giving tension on the corner of the mouth, which is classic myomodulation.
So when she smiles, you can
Yeah,
see
exactly. So
smile.
if you smile with your teeth, you see what happens. Look at the beautiful, show everybody. You see the beautiful excursion of the mouth upwards, whereas this one still wants to go down on this side. Smile again for everybody. Yeah, okay, so it's very natural. Okay, so that's the voluma part, but we still need to make her chin more feminized. So we do 2 injections here. Number 1 is to stop the project and stop the cleft. And the other one is to give elongation and stop this rotation upwards. This would be the first one. So on the bone, in the midline. By the way, in the center here, on the bone, there's no vessels, okay? Because they anastomose in the middle and they harborize and become like thin capillaries. So we do this one. See, there's a slight overcorrection. All I do is I mold that now within there's like a little sulcus between the two bellies of the mentalis here. And then the final one would be just here. For the camera, actually, I'll turn you this way, thank you. So we're going to go onto the anterior surface and do a projection like so. Thank you. So what this does now is that it centralizes the light reflex coming from her chin. So if you look now at her chin, she doesn't have a division between the two, and it makes it more female. Now what that's done is, that has made her chin more projected. It means that her lip requirement becomes even greater, yeah? So we need to tackle that, you know, and make sure that that's something which is rebalanced on the profile view. So we're going to go to Volift now. So we're going to imagine for a second that she has done all of her Voluma session and it's complete. She paid her money. It's just beautiful, absolutely beautiful. So smile, please, big teeth. Can you see everybody? She's more chunky here, yeah? Right? Again, smile. So she's slimmer on the side I injected the fillers. Now, you try and tell a customer, a patient, that I'm going to make your face slimmer with fillers. They'll think you're crazy, yeah? So unless you show them, and this is the thing, by the way, one of the secrets to success in the office is you've got to take your time with the patients. And I do a show with every patient that comes and works, sits down in front of me, because if you don't show them how amazing this is, you're not going to add value to justify your obscenely high charges, yeah. So, and that's the way it is, you know, because it is like it's a magic, you know. So you have to show them that it's a magic. So this is now sub-Q, and this is intradermal. Look, as I'm getting closer to the corner of the mouth, I'm becoming more superficial. So bone, sub-Q, intradermal or deep dermal, right? And what that does is, the closer you get to the corner of the mouth, and this is now again, is just in the surface of the skin, what it does is it drives the corner of the mouth up. So you have a very positive little flick. It's very pretty. And you need to use less as you go up. It's basically like an Eiffel Tower or a traffic cone, where you put more at the bottom, it's deep, and you put less at the top, and it's superficial, right? And that's how you're going to do it. This is the ligament here. This is the ligament there, right? The artery is here. Therefore, the safety is there, right? So you have to keep going until you get to the bone where there's no artery. If you just stop halfway and don't touch the bone, there is an alar branch of the facial artery which communicates to the nostril and the septum, and if you get that, the whole nose goes white. Okay, so don't do that. So let's do something. The artery is running like this. Let's be sensible and pull the artery out of the way. Yeah? Pull it towards you. Aim the needle towards the opposite oral commissure. Trajectory of safety. Oops, sorry. Then go down and touch the bone. Okay? Now we must aspirate. Big bubble. 3 seconds. A lot of the new advice is 9 seconds, but life is short, so it depends how much time you have. 9 seconds, man. Yeah, I can do a lot in 9 seconds. So 3 is fine for me. Okay, so I make 0.3 cc. And then we should observe some nice endpoints. What I'm going to do now is take this bolus and I'm going to squeeze it into the ligament and also push it now into the piriform edge to push the nose up. And also you should see the lip is starting to curl towards me. And the reason why this is happening is because it's pulling on the levator labii superioris muscle, and so we are starting to cause eversion of the lip. Yeah. What we should also see, yes, look at the nose. Yes, the nostril has changed, so it's starting to get squished and it's rotating upwards, right? And now we should have no nasolabial fold, and on this side she still should have it. But if you show me the smile, please. She should have more bulging on this side than this. Is it true? Yeah. So the reason for this is because what I'm doing is I'm stopping this muscle from overworking. It means she doesn't do this anymore, which means she looks more peaceful. Come this way, smile. She's more aggressive here. You see that? She's more dangerous and angry. So this is also a peacemaking gesture. You know, the trustworthiness, we were discussing this last week. Looking trustworthy is such an important characteristic for life, because you just you end up probably with more friends and you become more successful. If you look dangerous, people don't really give you the time of day. And so this kind of trait here, that's unacceptable. Right, look at this, everyone. So we did the deep injection on the bone. There's no artery there. This is a sandwich here, okay? It's a normal sandwich which contains the upper bread. Then it has a meat and cheese, which is the muscle artery and the fat. And then you have a lower bread, which is the bone. So never ever inject where meat and cheese are. You can always inject in the lower or the upper layer of bread. It's perfectly safe. So what I'm going to do is now, I'm going to superficially put these strands like this, you see. And what that means is, you know, like in a car, the suspension, it's like a shock absorber. So it stops it from compressing on animation. So pull it back and then just staying nice and superficial, like so. One, you can just do like two.
Can you lift the needle just to show how?
Oh, how deep? Yeah, sure, 1 second. There. So it's sub-Q. It's not in the skin. So like this. And then don't forget also, look, all women end up with this triangular depression. So whilst you're doing this, cure that too, okay? And always look at just test it with this sort of stress test there to try and fix it. Yeah, exactly, yeah.
The filler often makes it worse, you know, bad injections.
Well, a bad lip injection will always make this depression worse, yeah? They look like a duck then. Okay, now then, this is now completely fixed. But also look, it's fixed in rest, but also now in full animation. Show me a kiss, please, kiss. She should be more stable here. Now smile. No bulging, and then snarling and bulging. Very good. Look, she has no preauricular definition. So this is the angle of the mandible here, like so. This is the ramus, like that. So what I want to do is, I'll be inserting through here, yeah? And I'm going to reach, and I'm going to put 1, 2, 3 balls, okay? Each is roughly 0.1 cc. Then, when I do the balls, then I'm going to come back and I'm going to leave like a trace, like a comet's tail, like a shooting star, yeah, like that. And then what I'm going to mold, lift, stick, like this. But then also, I'll shape and mold into my finger to make a ridge. Yeah, that's pretty cool. Let's just sterilize again, thank you. Just for the entrance. It's Volift because we've chosen not to project too much, because I don't want to stop this. You know, the more drama a woman has in her face, you know, the more light and shade transition, really the more beautiful she becomes, in my opinion. Okay, so if you look at Kate Moss, she's a great example of that. She's very, very cut like this. And she photographs well as a result too. So this is the sub-Q. Thanks, babe. See if I can reach for, see, I'm just short, aren't I? I should have done it a little bit further up. Thanks.
Ready?
Yeah.
Dial of
Yeah,
Beauty, is that
yeah,
what
that's
it
the one,
says?
yeah. Okay, so get your little blood spot. Sorry, come this way. I think as I'm getting older now, I can't actually see things properly. So I need to, I believe I now need bifocals, you know, varifocal glasses. So, no. When you dissect this, look at the resistance. You have a lot of masseteric retaining ligaments here. So all those ligaments, they're all kind of getting in our way. So when you are dissecting, always give a counter traction there. So you don't want to hurt the patient. So just counter pressure like this. You know, I see some cannula users which is very rough and it's very painful for the patient. If you have a problem with being stuck on the ligament, just do a slight injection and anterograde because you open it up in front of you. So I get now to my first ball, here it is, like that. Bevel up, here was a little black triangle. And I'm going to restrict it here so it doesn't flow towards the ear, yeah? And then I do my 0.1 and I do my tail back like this, so. Next one, like so. So staying in the sub-Q, don't ever go through the SMAS. This, by the way, for the patient is a loud popping and cracking. Is that right?
Mm-hmm.
Yeah, very loud because I'm very close to the ear. Reassure them that there's nothing going wrong when you're doing it because they'll be scared that you're, I don't know what you, maybe in the brain or something. So put your finger here, look to stop it from flowing, 0.1, and then towards me, there, out, right. Now again, to this bottom one. Did you hear the crack?
Yeah.
Ligaments, right? And again, another ligament. And again, another ligament. Yeah, you got to, yeah. Here we go.
Breaking these ligaments, would that cause any problem later?
No.
In older age?
No, no. You don't want to break the ligaments. I'm trying to stick them back, actually.
Oh.
Watch, I'll show you now. So I do my other ball here, 0.1, and then back, out. Don't inject all the way to here because you'll end up with a collection. Right, that's not important what I just did. It's what you do now is important. So put your hand here, mold into your finger, right? To make the definition of the lateral border of the ramus. Right, now, second thing, take something like a swab. Basically, lift up, stick, right? Lift, back, stick, yeah? Lift, back, stick, okay? And what that's doing is, it's taking all of these little ligaments here, it's taking all these ligaments, and it's taking them from this position, and it's going like this. Up, open, attach, yeah? Because it's like a glue. Because that's quite a lot of product we did here. 0.7 or 6 or something. So this is all glue and it's stuck now. Have a look what happened to her face shape. Look, everybody. It's amazing, no? It's absolutely amazing. Look at this sagging cheek. Look at the leanness in the face. So you see, if you look down the line, you see very clearly what the changes are with the face, lifting. Look, everybody, I don't know because I can't see, but I imagine this is full and sagging and this is lean, right? Take a look. Right. Yeah. All right, good. You have to look carefully. So look up for me. Look, everybody, she has a cavity and it's almost gone on this side. Yeah, almost. So what I need to do, now look at this, come forward, eyes up to the ceiling. When she looks up, she has the lid cheek demarcation. Look, you can see, look, keep looking up. So she has the lid cheek demarcation here. This is the cutaneous insertion of the retaining ligament, right? So I must inject below that point, otherwise I'm going to make that bag worse. Keep looking up. So all I do is now pull back, down. Look, the maxilla is so far back that it takes a long way to reach it. Is there any pain at all?
No.
There you go. So now 0.1 cc. And what you'll find now is that, you know, this is the little ball of the pasta. Where are you? So the pasta, the dough.
You roll it up.
And we roll like this up. And with one injection, darling, and with one injection, I will cure the entire tear trough. So even beginners, you inject this point, which is 100% safe, because I kept it lateral and above the infraorbital foramen, and I can cure the entire tear trough simply by doing that. Now have a look at this. This is the old side. Look up, please. This is the old side. Look at this. Amazing. You don't need to be a good injector to do that.
Yeah.
Okay, don't ever put the cannula through the mound, the edema.
What's it called? Aspirating as well.
Okay, so now the facial vein is running actually in this channel. So sometimes you get a little blood in here, and then you get a bruise, which is not good, but that just happens sometimes, right?
Keep your eye on it.
Yeah, yeah.
So you're entering
27 for
approximately on the ligaments? Or on the
It's just in front of the ligament, medial to the ligament.
No, with the cannula as well.
Yeah, now look there, I'm underneath now the muscle. This dolphin now is going to dive down under the ocean surface. But then he's going to come up for air now here. Here, okay? Now look, this is under the muscle. Can you see this? That's under the muscle, right? But watch, I'll change the depth now. So when I come here, now is subcutaneous, right? So if you're going to do this technique, you have to be in this level. The reason why is that if you don't get under the skin and between the muscle, you'll be in the muscle, and means, because the muscle is attached to the bone here, means every time she blinks or smiles, squeeze the product towards the central part of the eye and you have a sausage. Yeah? Have a slug. Exactly. And it doesn't happen today, it happens in 2 weeks. Right? So let's just keep looking up to the ceiling, please. So let's just first of all, look, I'm holding like a pen, yeah? Not like a syringe. Because I need to dissect this first. So dissect, dissect. Look what I'm doing. I'm creating an envelope in which I can put the letter, yeah? And that letter is going to be made of very thin paper, and it's going to be like a little sheet. Turn this way, thank you. So look, I'm dissecting the skin off the orbicularis origin to make the envelope. And now once I've done this, then, only then now I can start putting the product. So Marco, this is the, if I'm going to do this, it has to be very light, yeah? So first pass, second pass, third pass, fourth pass. And all I'm doing is putting tiny little droplets. Keep looking up, keep looking up.
Also, because the extrusion force with the volite,
It's too very fast, yeah.
So when you're not injecting product, keep your palm off the plunger.
Yeah, because the volite is literally like olive oil. It's very thin.
How much?
No, 0.05, nothing. So it takes, look, all I'm doing is, I'm just creating, I'm breaking the bond between the skin and the muscle, so I separate them, and then I put the tiniest thin layer of the volite here. So watch this now. You know the dark circles? I'll show you something amazing. So watch. We have LED panel lighting, which is broad spectrum light. And look at the color of that lower eyelid. Isn't this amazing? Yeah? It's like makeup. She has dark
like a
circle,
concealer,
and now it's a
yeah.
concealer. But listen, it's a 1 year concealer.
True.
At least 1 year. And this is the magic of, you know, what we're doing now, is that we're changing, like if, look up please, you see, even it's stable in animation. She can't even create a dark circle on upward gaze. Right, now, we're going to go with the Volbella, lateral lid cheek junction for lateral canthoplasty. We're going to treat the forehead too, and we'll finish with lip and nose. So look, this is 100% fixed with the club sandwich technique. Now she has a hollow, which is here. She has one, which is here. Agree? Look at the other side. Look up. See, she has the depression. I want to make this eye look more happy. So this is just a snowman, yeah? It has a body and a head, yeah? The body is always bigger than the head, yeah? So I pull the lateral canthal ligament up, down to the bone, inject the body, inject the head, which always must be below the level of the lateral canthal ligament, yeah? That ligament is like this, watch. It goes like this. So it has to be below the ligament to lift it up. So I pull that ligament up, I inject a small bolus below that ligament, like so, 0.05 cc, and then I'll unite the two together. So again, take a swab, and mold and lift stick. This is internal adhesive, yeah?
Mm-hmm.
Where you're using a suture
Yes.
and I'm using a injection. So we have happiness and sadness here. And we have happy and sad here. So we change her perception of her mood. Yeah? Agree? And very small quantities. Yeah, 0.05 cc is nothing, yeah? There is a vector of lift that comes from this position here. Watch the vector of lift which affects the the inferior border of the medial malar compartment. Watch this. Can you see the buccal compartment being lifted?
Mm-hmm.
Right, there's a vertical vector down to the jaw. So it means that this heaviness here starts to improve as well. So there's 2 depressions in the forehead that I can see. She has one here. She has another one here. Okay, so we're going to go easy. Just go to the bone, touch the bone, aspirate and inject. So number 1, touch. Look what, see how I wiggle to make sure I'm definitely on the bone and through the galea. Now sometimes you can bend your needle here. So now don't worry if you make a bull's horn in Volbella, because it's just as soft as maple syrup. So all you do is you just squeeze it, okay, and it spreads. If you want to roll a ball into a sheet, then use a swab. Sometimes when you're rolling out pastry or pasta, you have to put a tea towel over the top of it. Actually, look, now this creates a slight reciprocal depression here. So again, we're going to be careful because I don't want to. Yeah, there's the anastomosis at this level. So I put a small little bolus, and always make sure you're on the bone. Okay, don't stray from the bone. If you do that, you're going to have potential problems. Now we do one more here, okay, and then she should have restored her frontal convexity. Bevel down. Why is the bevel down, everyone? Look there. Look at that, right on the bone here. So why is the bevel down? It's to make sure that I get under the galea and that the upper part of the bevel is not potentially hanging out of the galea and in an artery. Yeah? So mold, mold, mold. Now I'll show you something which is really, it's subtle, but in terms of feminization and really, if you like to perfect a result, it's essential for me. When I look at a woman with a male forehead, okay, if they have excellence elsewhere, they get away with it, yeah? But if you have other masculinizing traits and you leave a male forehead intact without convexity, it's actually quite a negative. So let's just mold, right, like this, and then let's take a look. Can you all see she has a big hole here? Yeah? And how now when you look at this side, how it's uniformly convex, right? Let's look now at taking, I mean the brow is even higher now. Yeah, it's shorter, yeah. Because we created one, when you have one light reflex, the forehead looks shorter. When you have 2 points of light reflex, it elongates the forehead even more. It looks more male, like me. Now let's see, this is the test, whether I'm a liar or not. If we lift the eyebrow up maximum, more, right, look at this. So you see how we stop the excessive contraction and we have more organized movement. So lift the brow. You see this, how she has a peaking at that point because she has hyperactive fibers. But this side, her movement is stabilized. Yeah. Lift the brow. You see that? Look, everyone. Should a woman have big or small eyes? Right. Why is this eye so much bigger than this one now? Why? And I'm using fillers, not Botox. Remember I told you, I'm weakening muscles by expanding them. I expanded orbicularis oculi here, 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 and here. Look at the size of the eye. Unbelievable. Amazing. So, and girls use makeup to make their eyes look bigger. But this is a lie, right? This is the truth with the injection. Right, first of all, let's just deal with this labiomental crease because she's still got a superficial weakness there. So I'm going now over the top of the voluma with the Volift. Now, you know, I'm right over the top here of the inferior labial artery. So do not go deep here, right? And you know, I did a show in Seoul in Korea where the guy actually didn't just go deep, he went into You went into here, gingival sulcus, here. Look how the lower lip is closing with the injection that I just did. Smile with teeth, please. More. Yeah, it's all weird, yeah? Okay, relax. Now what we're going to do, open the mouth slightly. We're going to now give anterior projection for the lower lip. So, 1. Staying above the muscle insertion. That's number 1. That's the medial tubercle. Number 2, like so. Can you see the flick that just happened there? Close the mouth. Good. You see this? She's coming forward slowly. Open again. So we go a little bit more superficial now. So I'm just going to keep this very submucosal in the center. Like here it comes now, like this. Open again. More. And by the way, close. So look at this now. See how she's coming forward. So you should find that on the profile, she becomes more acceptable, the difference between the two. Before she's very retruded, now it's starting to become more acceptable. And then what you can do is if you want to just have one final definition for the lower lip, you can go across just at the red-white junction on the mucosal side and give a little flick. Now that's for the absolute result on a 90-degree lateral profile like this. So she becomes much, much more acceptable. She's never going to be perfect here because this degree of over-project, she really has this, class 2, yeah, what do you call it?
It's class 2, division 2.
Division 2, wow, there you go. So this is thick sebaceous skin, so always be aware that you may have difficulties as you dissect past the ligament that connects the lower and the upper lateral cartilage and the upper lateral cartilage and the nasal bone with the nasal valve. That's, sometimes tricky.
Do you want to just move ahead of the camera?
Yep.
Just so
Okay. So look, dissect gently. Don't force it, nice and gentle. And you can pull the skin off the bone like this. Now I'm stuck on the nasal valve and pop, yeah? Okay. Don't force it though. Now, look what I did here. I'm changing the angle of a tip, yeah? So when I'm at the radix, look at me please. There. Now when I'm at the radix, now up at the base of the upper eyelash, then pinch, and now we start to inject all the way down. Nice, gentle, gentle injection. Pinch. Always pinch it because you want to keep it in position. You don't want this stuff to start to drop off the edge of the nose. And here at the tip, what I do is I just do a very slight little, like a little ball. See? Just to sharpen her up. Baby, please. Right. Now, profile is okay with the product in, but look, it looks a mess. Yeah? But that's the beauty of the Volift is when you do it, it makes like a worm, yeah? But you just take your fingers, probably the 2 most valuable tools in your office is this, not the stuff. And just pinch and hold firm like this, okay? And bring it together. So you're going to bring it together like that in the midline. Okay, it's almost squeezing out of the tip like this, yeah? Right, now. So. Any little stray bits, you just push them back into position like this. It should be very nice and soft. Just like a honey. And squeeze again.
What if she loves it afterwards?
No, it's fine. The only thing I would say is no glasses for 24 hours.
Okay.
Yeah, because otherwise, if the glasses rest on the bridge, you'll get a dent, yeah? Because it's quite soft. And then finally, she has a nose which has the same light reflection as the sister, yeah? So nice and fine, yeah? And see, she's got a slight little, the issue is that she's got this, maybe just pass it back a second, I'm just going to show them how to deal with this little defect. So look, she has the uniform all the way down this side, but see this little hollow here, so we'll take this now, okay, and because it's a cannula, it's completely safe to go slightly off the midline here, and then just pinch into there, like so, like that. Okay, baby, please. And then squeeze this into position. When you are a perfectionist, you want to try and always make sure that before she goes, it's absolutely perfect. Because, don't if you see something in that moment, don't say to them, you know, when you go home, try and mold it and massage it to make yourself feel better. The likelihood is it wouldn't change, okay? So you should take control always and make the perfect result.
Is that
How many minutes do you have to mold?
Very excellent question. 30 to 60 minutes maximum. Okay? After that, it's set.